In this video are going to be some of the stories of breast cancer survivors. They are going to tell you their stories themselves just to give you hope. We are in the month of October, the breast cancer month. Worldwide, we are celebrating breast cancer. For the past weeks, we have been talking about breast cancer. I'm not a health practitioner, but I have spoken with them and they have given me the knowledge about this, and I'm coming to say it in the video. My name is Anastasia Minta, a relationship and a sex coach. This is my YouTube channel. Press on the subscribe button to subscribe to this channel. What is breast cancer? What is the age range for one to get this disease? 40 years plus, but younger people too can have it. What gender gets this disease? Both gender can have it, men and women, but just that it's most in women. Me, at first I thought it's for women only. How would one know they have this disease? What causes breast cancer? If you find anything funny about your breasts, quickly see a doctor and do not self-medicate. Get the right attitude and be grateful for the people that are around you and are helping you. When people get this disease, they tend to ask themselves certain questions, and these are some of the questions. Why me? What did I do? They think they have been punished. Trust me, you don't need those questions at that stage. And some people will also be scared and say that I don't want to die. Is breast cancer a death sentence? No, it's curable. That's if you detect it early and do the right thing. But if you wait for it to get to the source stage, then I'm afraid to tell you, you might die. Early detection is the best. When you are being diagnosed of breast cancer, be at peace with your new reality. A lot of people tend to blame this on spirituality. Even if there is the possibility of spirituality in your case, do not do the spiritual and neglect the physical aspects. Else it will be too late for you. Do both at the same time. Talk about the situation. Open up to get help. You see, in the kind of society we find ourselves in, people are being stigmatized when they speak about their illness, not even this disease, but some other disease. So it makes it very hard for people to come out open to talk about their disease. I would encourage you to speak up. Even if you think they are going to laugh at you, let them laugh. Let them say. And I want to tell you, there is nothing to be ashamed about this disease. It can happen to anyone. And it's not a curse to have this disease. I'm just encouraging you in this way. Fight breast cancer because you are a fighter and a survivor. You can do this. Maybe you have it already. I'm sorry you have it. But then fight. You are a fighter and a survivor. And to every woman out there, please check your breast regularly. Now let's go and listen to the survivor story. There we go. See you in my next video. My name is Anastasia.
I'm Sandhya Bihani and I'm 57 years old. I'm mother of two, a daughter and a son. January of 2019 is when I was diagnosed with breast cancer. I had my surgery, a lumpectomy. I also went through chemo. After that, I had my radiation. And now I'm going through my Herceptin infusion, which will be for at least a year. I was a person who was very reluctant on having my mammograms. My OBGYN would say, oh, annual mammograms, routine. I have no history of breast cancer in my family. And I said, okay, before I go see my OBGYN, I'm going to have my mammogram done. I went for my mammogram, and in my routine mammogram test, they found it, and then they recommended biopsy, and that's how they found it. It was stage 1 HER2 positive breast cancer. Breast cancer, this journey and all that Mayo has to offer, the coffee and conversation, the one that Susan Cain organizes for breast cancer patient, which is once a month at Mayo Clinic. To me, that is very important because there are subjects or information that's shared during those conversations is very relevant to what I'm going through as a cancer patient. There are a lot of experts or doctors or care providers who come and speak or share their knowledge and experience is something that I'm looking firsthand. So instead of going and buying a book or trying to read online and not knowing if I'm getting the correct information, coming here once a month, being with others who are going through similar breast cancer or other cancer treatment like I am, being surrounded by them and sharing our experience, laughing, talking, along with a cup of coffee, and at the same time getting all the information that is pertinent to my treatment or something I may have missed, I may have not even known. All that information that they provide is vital, and I look forward every month coming and being part of this Coffee with Conversation. My motto is attitude with gratitude. If you have the right attitude and at the same time having gratitude for all the people, everybody, professionals, your family, friends who are helping you in this journey, to appreciate them and be thankful for everything that you have. The future looks so bright. The future is awesome because I know I'm in the right place. I've got the right treatment. Everything is falling in place. So we look forward to seeing every stage in our life with a lot of love and enjoy every moment that we have.
My name is Bernice Grossglass. I'm going to be 54 very shortly. I am here because I was asked to talk about my journey with breast cancer. I was diagnosed last April 2018, triple negative, stage 2. When I discovered my own breast cancer, I immediately, Mayo was the first name that popped in my head. I feel like they're a family because I was here all the time, and you have a team of professionals, and it seems like they just focus just on you. And I know that there are other patients, but it just felt like, the attention was on me, and let's see what we can do to help her. And they were just wonderful. And I just felt like I knew I came to the right place and that they were going to help me eradicate my breast cancer. Then, I thought, okay, this can't be happening to me. Why me? And then I thought, okay, I don't want to die. I have a lot to see. I want to see my son get married. I want to see my first grandchild. And so I was scared because I didn't have answers. And once I got the answers from Mayo, then I was at peace with everything, what was fixing to happen to me. They gave me a plan of what they were planning on doing, and I was like, okay, let's do this. I also have, 2 other friends that also went through breast cancer at the same time I did, and we all had the same type of breast cancer. So I already had a support group, and we would just talk and ask each other how we're doing and what's going on with your treatments. And so I really do think that having other people, talking with other people who've experienced the same thing as you, just kind of makes you feel like, okay, I'm not alone. This does happen to ordinary people, and it is what it is. But we're going to survive. We're fighters. So, and I'm definitely a fighter, and I'm feeling great now. So, talk with other people if you have fears, because I think that talking is good therapy. And even if you're talking to someone who's never experienced it before, it's just good therapy to talk about it, get it off your chest, and share your feelings of how you're feeling. And going through it, I also had my moments of depression. I had meltdowns by myself, feeling sorry for myself. But like I said, once I got the answers, I felt at peace. with everything, and I knew that I had good people helping me, which is Dr. McLaughlin, Dr. Chumstreet, Dr. Renker, and all the nurses, everybody. They were just wonderful, and so definitely talk, just share your stories, because that's good therapy right there. The other women that I encountered while being here, we would talk, and they would, with their experiences, because they were like survivors, and they would tell me what worked for them, what didn't work for them. Yeah, just having answers. That's key, to having answers, because then you know what you're dealing with, and then just you work your life into that. And just don't let cancer stop you from doing the things that you enjoy doing. And that's life. The rest is history. But I feel great.
My name is Dave Wiggum. I'm 60 years old, and I'm currently in treatment for breast cancer here at Mayo. I was in the shower one morning and felt a little something on the side of my nipple, and so I mentioned it to my wife, and she said, "You should talk to your doctor about that." And I said, "Oh, I have an appointment in a month. I'll talk to him then."